Hi everyone, this is Dr. Nicole Nemeth here at Plastic Surgery of Westchester. I'm a board certified plastic surgeon and I'm here to answer some questions about breast reduction. The first question is, will my breast look lifted and round like after an augmentation? The short answer to this is no. Breast augmentation typically uses an implant, and that implant will create a bit more cleavage and shape and roundness to the top part of the breast, which we can't necessarily do with a breast reduction. The purpose of a breast reduction is quite the opposite, and that's to actually remove volume or remove tissue. And in some cases, and it really depends on you and your body type as well as your breast type, we can create very nice cleavage and shape, especially in that superior aspect of the breast. But a lot of times this is a more natural type of appearance to the breast or shape to the breast, which is not going to be the same as what you would get with an implant placement. The next question is, how much smaller can I go and can I choose my cup size? Again, in a way, yes, we can have that conversation about what your goal cup size may be, but I tell patients you have to remember that cup sizes and bra sizes, if you will, are not an exact science. Different manufacturers have different ideas of what a C cup or a D cup, for example, might be. So we really talk about in relation to where you are with your current size and how much smaller in relation to that we may go. We know that we can make the breast smaller or more lifted, but absolutely cannot guarantee the cup size. Will I still have cleavage after reduction? This really depends on your breasts. If you have some cleavage at this time, probably have a lot, but if the breasts are somewhat placed closer together, you'll have a lot more cleavage after likely, versus someone whose breasts are situated more far apart. So something that you will talk to your surgeon about during the consultation. The next question says, do I need implants after reduction to keep upper fullness? Again, needing an implant after a reduction would really depend on what your aesthetic goal is. The goal of the reduction is to reduce your size for comfort. Now, if we're talking about preserving a shape or creating, again, some more augmented look for the cleavage, then we might talk about placing an implant. Seems a little counterintuitive, but even a small implant can create a little bit of that fullness in the upper pole. Will my nipples be moved or changed in size? And the answer to that is yes. Oftentimes with an enlarged breast or macromastia, the nipple areolar complex has also become enlarged. So to create the best aesthetics and to preserve that proportion, when we reduce and lift the breast, we also like to make the nipple areolar complex a bit smaller. We try to shape them round and more central and front facing on the breast so that it is more proportionate to the smaller breast. Will I lose sensation in my nipples or breasts? The answer is anytime we do this type of surgery, there will be scars. There's also the possibility that because of the manipulation on the breast tissue and around the nipple and areola, that sensation can change. Sometimes it can actually be increased now that your nipple is pointing more forward, for example, rather than down. You might actually have increased sensation. But sometimes you can have decreased sensation on one or both sides, which can either be temporary or permanent, and we cannot promise that that sensation won't change either temporarily or permanently. Something to think about if sensation preservation is of utmost importance to you. Next question is along those lines, can I breastfeed after a reduction? The answer to this is likely yes, but it just means that if you were able to breastfeed before the surgery, the chances are likely that you can after. It becomes harder when you're not sure if you were able to breastfeed before, as in you didn't have that opportunity, but the majority of women can if they were able to before. Will I have visible scars and where will they be? Yes, technically you will have scars on the front face of your breast. It can be of different patterns, and that depends on the type of reduction that is recommended for you. In the minimum, you're going to have some scar around the nipple areolar complex. The next scar will be like a vertical scar, like a lollipop style. And then the last component on a full scar or a wise pattern breast reduction is the anchor, which includes the incision that goes underneath or is hidden within the inframammary crease or fold. How long will it take for the final results to show? It's a great question. You're gonna notice a change right away, which is the beauty of this operation. Full healing can take a few months and up to a year for the scars to fade, but in general, you're gonna be better healed in that 4 to 6 week period. Can a breast reduction help relieve neck, back, or shoulder pain? And the answer is yes. So if you have upper back, neck, shoulder pain, you have pulling on the bra straps called bra strap grooving on your shoulders that's creating indentations or discoloration, if that is caused by the weight of heavy breasts, then you will have relief, and it's a very satisfying operation because that relief is almost immediate, and over time you will feel less tension on your shoulders and your trapezius muscles and your back. How long is the recovery, and when can I go back to work or exercise? So how long is the recovery and when can you go back to more regular activity? Usually at around 6 weeks, sometimes 8 weeks. That's the amount of time that it's gonna take for your scars to have the most strength that they've had since surgery and to be able to withstand a bit more lifting and activity. Be certain to ask your surgeon though before you go back to regular activity, and they can guide you on the best time for that. And then lastly, is breast reduction covered by insurance? And for many people it is. It will really depend on your presentation, meaning what are your symptoms, how large are your breasts, what are the measurements, what kind of difficulties are you suffering as a result of macromastia or enlarged breast. It will also depend on your body type. We take all of those factors into account when we talk to your insurance company, but that is something that really you should let us handle, and it would be part of the conversation we have with you in the consultation. If you have any questions in addition to these or want clarification, or certainly if you want to have a consultation, I would encourage you to come in and see the surgeon here at Plastic Surgery Westchester, and we're more than happy to go through all of these things with you and talk to you about it on a more personal level. Thanks so much.